Indiana in the Morning, presented by First Commonwealth Bank on the Voice of Indiana County, WCCS 101.1 FM and AM 1160. And it is time now for our interview segment, brought to you by Marcus & Mack, voted the best personal injury law firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people. And we are also live on Facebook this morning, so you will see from left to right on the Facebook screen Dr. Dan, and on the right, Dr. Margaret Clark, husband and wife team of Indiana Regional Medical Center's Breast Cancer Department. And it's so good to see the both of you once again. I really enjoy both of you coming by to visit this morning.
Thank you for having us.
Yeah, it's great to be here again.
All right. So first off, I think we ought to talk about, of course, this is Breast Cancer Awareness Month, and it's more than just wearing pink and thinking about the people who are afflicted by breast cancer, but it's also about the fact that this is still an ongoing medical issue. I'm trying to find the right words for that.
Sure.
I'm sorry, Dr. Clark. But obviously, people continue. I think there's more people nowadays that are probably getting screened for breast cancer than in the past, right?
Well, there are more people getting screened. We had a significant decrease in the number of people getting screened during the pandemic. Mm-hmm. And, it was difficult as far as what the recommendations were, and everybody was staying home and everything. So that unfortunately has been shown to be detrimental to women's health overall. But hopefully we're starting to get back in there again and getting everybody screening. Katie Couric's new diagnosis and being on the Today Show and raising awareness once again about the importance of screening has helped us.
Oh, yeah, I'm sure. I didn't mean to interrupt you. I'm sorry. But Dr. Clark, maybe you can talk about those screening recommendations. I mean, what age should a woman start thinking about this seriously?
Well, they used to say at age 35 you should get a baseline screening mammogram. That has actually been disproven that it really didn't add any benefit. So the current recommendations for the average risk woman is to start your baseline mammogram at age 40 and every year for life. And, there's no age cutoff. And a couple of years ago, the U.S. Preventative Task Force came out and said get them at age 50 and then every other year and stop them after age 75.
Yeah.
And that was widely blasted by the breast community because it wasn't based on good, sound data. And the data actually showed our biggest improvement in mortality has been in women between the ages of 40 and 50, not after 50. And that's all because of mammograms during your 40s. So it made zero sense for that recommendation. That was all cost-benefit recommendation. So age 40, for average women at risk every year for life.
Wow, that's pretty amazing how what we had normally thought of as the recommendation, it just keeps changing, it just keeps evolving. I think it's just because of the fact that more knowledge has come in about breast cancer and how it attacks people.
Absolutely.
All right. This is obviously not a disease, and I know this, and I think a lot of people know this. This is not a disease that's communicable like, say, the common cold or the flu. This is something that has to do with circumstances, with genetics as well, I believe. So because people can be genetically predisposed to breast cancer. I think we heard a tale about that at the Love of Life campaign kickoff event about a month or so ago.
Right, yeah, and as you may know, that when I came here, I brought genetic screening to the county as well. I've been doing genetic counseling now for 11 years. I've been certified by the NAPBC that certifies breast programs for genetic counseling. And it's not just BRCA1 and BRCA2 anymore. That's BRCA for breast cancer. We now know there's 11 different genes that lead to an increased risk of breast cancer. So if you come in, we screen you for your family history, your risk factors, and then determine whether or not you should have genetic testing, because that changes recommendations dramatically.
And how dramatically can it go?
Well, how dramatically can it?
Just kind of playing off of Dr. Dan's response there. Just how important is that genetic test?
Well, it's very important. But on the flip side, though, from what I see, quite often I have patients say to me, "Oh, I'm not too worried because I don't have a family history." And while genetics and family history is extremely important in identifying people who are high risk, on the flip side, only about 25% of the new breast cancers that we see have a family history.
Oh.
So that's we talk about genetics and high risk and the the BRCA mutations. But it's very important that people who don't have a family history, they don't have any genetic predisposition, still get screened. Because there's quite often that misconception in the community that if they don't have a family history, they don't have to worry.
What are some of those risks outside of family history that could make somebody probably, I don't want to say more vulnerable, but probably more open to getting breast cancer? What are some of those outside influences that could be a part of this?
Well, there are multiple factors. Some of it relates to when a woman starts menstruating, when they stop menstruating, relative to the hormone levels, and not getting a break in hormone levels, not having their first child until after the age of 30 is another thing. And certainly a big thing is dense tissue. We used to think that the importance of dense tissue was that they have white tissue on mammogram.
Oh.
And masses are white and cysts are white. So as you can imagine, they hide against that white background, as opposed to our patients who have fatty tissue that is black, so those white things show up better.
I see.
So that was always the most important thing. But newer research has shown that people with dense tissue have a 4 to 6 times greater risk of developing breast cancer compared to people who have fatty or scattered fiber glandular densities.
Makes sense, actually. It sounds like it does anyway, but I'm glad that our listeners are getting this information. So, Dr. Dan, when you came to Indiana, one of the goals that you wanted to do was you wanted to make this a nationally certified breast cancer treatment center. I hope I'm getting that title right. But you've succeeded in that. You've succeeded in that, I think, by the biggest margin of all, because it was done so quickly. And people just got on board with this right away.
Yeah, when I came here, it basically said, if you want me to come, I want to become a nationally certified breast program. It's called the NAPBC, the National Association for Breast Programs. And it's run by the American College of Surgeons Commission on Cancer, the same program that certifies cancer programs across the country. And it's very rigorous. And it's not just my department, the whole breast cancer program. Oncology, radiology, surgery, everything, physical therapy, everybody has to be on board. And you're right, it was very easy here because everybody just said, what do we need to do? And in the process, we also became the American College of Radiology Center of Excellence in Breast Imaging. That's also the highest certification the American College of Radiology gives a breast center as well. So not only did we get the national certification from the cancer program, but we also got the highest breast center certification from the American College of Radiology in the process as well.
We should mention that Mrs. Dr. Clark over there, Dr. Margaret, is the newest addition to the staff of this program. I have to ask, because I think I heard a little bit of this again at the Love of Life campaign kickoff event. Hearing all of that, hearing your husband's work in making this a nationally certified center for breast cancer treatment, was that one of the big things that you said, hey, I need to come up to Indiana now?
Oh, absolutely. And he had been telling me for a while what a great place it was. But having all those things in place made me more than happy to come and join the program. All the things available, so I feel like I can take good care of patients. So
how has it been for your first couple of weeks, months up here in Indiana?
It's been great. I just have such a great team to work with. The mammography technologists, the ultrasound technologists, the radiology nurses, our nurse navigator. I have a great team to work with, and I really feel like I'm able to take good care of patients because I have such a great team.
And you were telling me off mic that you are that you have one specific dedicated service as part of this, right?
Correct. I only do breast imaging. I don't do any other part of radiology. I read mammograms, breast ultrasounds, and breast MRIs, and also do biopsies using those modalities to guide the biopsies.
Mm-hmm. This is Indiana in the Morning, presented by First Commonwealth Bank, and we're talking with Dr. Dan and Dr. Margaret Clark. One of the things that I often think about, and this is just because of the fact that I'm a game show nut, I'm a game show trivia freak. There was a famous announcer by the name of Rod Roddy, who was the announcer for The Price is Right. He had male breast cancer. Mm-hmm. So this is not something that's just excluded to women. Men can get this too, which is, I think, something that it may seem like it's out of left field, but it is certainly possible.
Yes, it's not nearly as common in men, but it is. When you do have a male breast cancer, that actually dramatically increases your likelihood of this being genetic. And so that if you have a family member who has male breast cancer, then the whole family should probably be tested for genetics because, and the problem with men is that oftentimes it's disregarded as gynecomastia, which is male pattern breast growth, which is very benign.
Yeah.
It can happen from medications and different things. But breast cancer can feel the same. And so actually those men need a mammogram, actually.
And knowing a lot of guys like I do, we're like, no, they don't want to go to the doctor's office or they don't want to go in for these specialized checkups because they feel it might not be manly, or it might not be it might be humiliating for them to say, hey, I got to go in for this. So, but let's dispel this right now. It needs to be done.
Absolutely, because just like everything, the earlier the diagnosis, the better the outcome. We know with stage 1 breast cancer, we have 95% survival. And so, the same things happens with men. If we can get it at stage 1, when you first feel a little nodule, not ignoring it, we have better outcomes. Unfortunately, like you said, most men don't come in when they first feel something, and they wait until it's rather large, and by then it's not a stage 1 anymore.
Yeah, it's usually like at the point where it's beyond no return almost. I don't want to put it in those terms, but it's usually at a very severe stage at that point. Yeah. But anyway, I'm glad. Go ahead.
Oh, I was to say, but by the same token, gentlemen who have lumps, very, very common. And doing a mammogram, we can very easily dispel any concerns, and we tell them when they come in, they come and see us, we do a mammogram. We can see very often, more commonly, that it is gynecomastia, as my husband mentioned. And we can tell them right there and set their mind at ease. So, that's why don't delay. Just come in and see us, and we'll make sure that we can take good care of our gentlemen as well.
How can people get in touch with the breast cancer department over at IRMC to take advantage, maybe schedule a mammogram or get their genetic test done?
Well, scheduling a mammogram, they can call 724-357-8081. And
Genetic testing, if you just call the main number for the hospital and ask for the surgery department, we have genetic screenings every Friday in my office. And so it's just a simple thing of calling my office and getting an appointment.
Excellent. We are out of time. In fact, we're just about over the mark. But I do want to thank you both for coming in. This is a very serious topic, and we want to see that number of cases of breast cancer go down, even if it is in Indiana County. We hope it is throughout the nation and throughout the world. But let's keep the awareness up so that way the numbers can come down. Thank you both again for joining us.
Thank you.
That was Dr. Dan and Dr. Margaret Clark joining us this morning on Indiana in the Morning. Our interview brought to you by Marcus & Mack, voted Best Personal Injury Law Firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people. We're coming up against the mark, so let's go ahead and get to the CBS Sports Minute.